and welcome to Chico Unscripted. Today's episode, we're going to be talking about medical diagnostics. What is a medical diagnostics lab? What is the importance of a lab within the general healthcare systems? How a lab functions inside of a hospital. I'm sure many of you, every time you go to the hospital and the doctor says, go to the lab, either go for a blood test, a urine test, or any other type of fluids that you have to give them, you don't really know what happens after that. However, today we're going to get that insight into what is a medical diagnostics lab within the general healthcare system. And also, what are the causes and consequences of misdiagnosis? And do Gambians still need to travel abroad in order for them to get the care that they can have here in the Gambia? Those are the topics that we're going to cover today. And so I want to introduce to you doctors, medical scientists, and a company that has set itself as a goal to transform the healthcare sector here in the Gambia. Follow me, let's discover what is medical diagnostics.
So I'm Dr. Keba S. Marina. I'm an orthopedic surgeon and I am the medical director of Jalma Specialty Hospital. So to answer the question about what a lab is, I'll just sort of talk about how doctors come about a diagnosis. I think you can often divide it into two parts. There is what we call the clinical part, which is when the doctor sees you, takes the story, what we call the history, examines you, and makes some findings. They then, with the knowledge they have a reasonable idea of what is wrong with you, but then we have something called diagnostics, which helps to confirm that. So that involves various things, which include what we also term as the lab, which are often referred to as blood tests. It's more than that, of course, but there are often signs that would be in your blood, in various fluids that we can take from the body that will confirm what the doctor suspects is a diagnosis. Otherwise, we're just working on a suspicion, and we can't really say that this is definitely what it is. We can think it is, but if you have something that will show you and say this is almost certainly what it is, then you have more certainty in your treatment. And that's the role of a lab. So they do blood tests, they do lab stool tests, sputum tests, and other diagnostics that are possible. So the lab is the second part of the experience of going to the doctor. And then we put it all together and give you a diagnosis and start your treatment.
My name is Sirfo Suare. I am the lab manager for AQA Medical Diagnostics Center in Banjul branch. A medical diagnostic lab is a healthcare center that conduct medical lab tests to provide reports on patients' condition to find out what is wrong with them using specimens like blood samples, stool, and other body fluid, urine as well. And also to help doctors monitor the treatment of their patients and nurses.
Assalamu alaikum. I'm Dr. Tanveer Ahmed. I'm Managing Director of Ahmadiyya Muslim Hospital, Talinding. Medical laboratory is a backbone for your diagnostic. So whenever we are diagnosing our patient, to confirm our diagnosis, we always go to medical laboratory where we can get the proper and final diagnosis. So for me is very important and crucial role it is playing in our diagnosis.
So now that we know what is a medical diagnostics lab, it's also very important for us to know what is the importance of a medical diagnostics lab within the healthcare ecosystem. So we're going to be able to talk to some specialists, experts, medical scientists who will tell us exactly what happens in a lab and what is the importance of quality.
I am Therese Mendy. I work in AQA Medical Laboratories as the quality manager. The importance of diagnostics within a nation is you have the lab wherein we're always behind the scenes. So whilst we're behind the scenes, we're also playing a very important role, because without the laboratory's results and accurate results for that matter, the physicians or the doctors will not be able to give accurate diagnostics because they're dependent on the results that we're providing. So being in a lab and being able to provide reliable results, quality results, will faster or will enable the physicians to be able to give timely interventions to these patients.
It is very important for patients to come to the lab because there's this saying that goes, without us, your doctors are guessing. Literally meaning, for a doctor, they can do the investigation on you. That is, check your body, like the physical check-up, and also suspect. To some extent, all they can do most of the time is suspect, right? But most of their decisions are based on lab results. That is the results, the tests and the investigations that are done by lab scientists. So a doctor can suspect something, but for him to be sure of what is actually wrong with you, he has to send you to go and do investigations. Only then he can be sure of what he really suspects is wrong with you.
Most of the time we see patients that we send to the lab. Sometimes they do ask why I sending us to the lab. Yes, in layman terms, in terms of laboratory, we send them, and then of course we explain to them to say that this laboratory test, as we said, we are here. We are not magicians. We see patients, examine them, and we send them to lab just to make sure the lab will help us in other way to diagnose your condition, to help us know what exactly you have. So that's why we do explain to them why the importance of the laboratory, how the laboratory is important, an important factor for us to have what we want in terms of the diagnosis wise.
Diagnostics is one of the most important elements in healthcare settings. Like 70–80% of this that the doctors make come from the lab, right? Because because there are a lot of diseases have the same symptoms, right? So what will confirm, right, which kind of disease or which kind of illness you're having is from the results. So the results the laboratory is producing, right? So that's why a laboratory is very, very important in healthcare settings, right? Because the doctors cannot make any informed medical decision without having the accurate result from the laboratory, right? So that's why the lab is very, very paramount when it comes to the healthcare ecosystem. Because if you look at the lab, there are three phases of the lab. You have what is called the pre-analytical phase, the analytical phase, and the post-analytical phase. So the pre-analytical phase is the one that where we have the contact with the patients. That is the drawing of the blood, the collection of the urine sample, stool sample, or any other sample that is required to do the testing, right? So once the samples are collected in the lab, from there they move to sample reception. Sample reception, that's where all the pre-analytical checks are done. That is to confirm whether the sample is hemolyzed, to split the sample, to separate the samples into different departments. Because you have different departments in the lab. You have the hematology, the biochemistry, the immunochemistry, the microbiology, the histopathology. So sample reception is where all the samples are separated and being taken to different labs. So now the analytical phase is where the testing starts. Right. Once those samples are taken to those labs, that's where the processing starts. And from there, analyzers are on, quality controls are on, because quality control is basically the background of ensuring that any results that you're producing is as accurate, right? So it's a culture here in AQA that any machines that we have or any tests that we are doing, before we proceed with testing patient samples, we start with running the controls, because the quality controls will basically tell us whether the machine that we are using is working fine or not, right? But when we're standing through, we also calibrate, right? So we calibrate, that is, it depends on which analyzer we're using, right? So calibration and quality control is something that we pay much attention to, because without these two, it will be difficult for you to basically ascertain if the result that you are producing is accurate or not.
So we've heard the doctors and the lab scientists tell us why a lab is important within a hospital and the medical healthcare system as a whole. Let's find out, what are the causes and the consequences of a misdiagnosis? When all this work doesn't really pan out to the result that actually helps the patient, what happens next?
What causes misdiagnostic? It can be caused at different stages. We talk about the stages first. It can happen at the hospital or at the clinic level. It can happen here at the medical lab centers too. That is giving somebody a wrong results or a wrong treatment or a wrong prescription in terms of medication. Per se, suspecting, let's say, diabetes, and now you're treating this patient as a hypertensive patient. This could be due to the report you receive from a diagnostic center, or this could be due to you suspecting and you don't conduct any investigation to confirm what you suspect is wrong with this person. All this could lead to giving them a wrong prescription, treating them for so long, which is very wrong, on a wrong base. This is what normally referred to as. The consequence of misdiagnostic on a patient, this can lead to death. It can lead to it can have severe health impact. It can also give a bad name or can ruin reputations of diagnostic centers or even doctors that are treating this patient. It can lead to a long time of wasting resources, wasting time and wasting a lot of things, because of the wrong diagnostic you're doing. Before you realize all we're doing is not the right thing. It can take months, probably years, and a lot of things can go wrong. Resources, if the patient is lucky enough not to die of this particular thing, they can have serious health impact that might last for lifetime.
Well, misdiagnosis, perhaps we can have that in different ways. Or sometimes clinically, you can miss. It's possibility that you miss also from the clinic. That's why it's important. Take the patient history and also check the patient physical. We call it physical examination, and then before you send to the lab, you can miss from what you send to the lab concerning the patient. If the patient diagnosis is not well, at least you are not sure what you check. It was not exactly what the patient was having, and you send for something else. So sometimes you can have some misdiagnosis in terms of that as well.
Consequence of all diagnostics, it's many, and it basically has like a huge impact on the patient. That is either the family of the patient or the patient itself, right? Like for example, if a patient is wrongly diagnosed with diabetes, for example, right, that consequence can basically have some financial, right, impact on the patient, right, even psychological impact on the patient, right. It can also lead to, like for example, wrong diagnostics.
In the lab, you have three phases. You have the pre-analytical, you have the analytical, and you have the post-analytical. In the pre-analytical, that's where you have sample collection, you have patient registration, you have centrifugation, and that is where most laboratory errors occur. So just collecting the wrong sample or collecting a sample unlabeled will have an effect on the results that you're going to produce. Or registering a patient with a wrong test. If a patient comes in asking for glucose and you register the patient with PSA, you run in the PSA, you will give the patient the wrong results, and the wrong results will result to wrong diagnosis at the end of the day. So most of the times we have the shuffle between us and the hospitals in terms of how well the sample was collected. So we have escorts that will bring in samples. Sometimes the samples are unlabeled. Sometimes they will be in inadequate volume, and they will try to explain to them that the sample has to be in right quality for us to proceed with the test. But sometimes they do not understand the reason why we're telling the escorts to go back, recollect the sample, have them recollect the sample and bring them back to the lab. They will just be, oh no, you can just pour the sample in another tube, or just run the test anyway, because it was difficult to get the sample. But what they do not understand is just by collecting the wrong sample in the wrong tube will have an implication on the results that is produced at the end of the day.
So the main causes for misdiagnosis are what we often sort of say is working in the dark. So as I explained with the essence of a lab, what we have is clinical acumen. We are trained for years to develop a certain amount of clinical acumen that helps you make decisions and make diagnoses. But often, sometimes they're vague. It depends on what the patient tells you. If someone gives you a history or doesn't give you a full history or story, and you only have part of it, you might come to the wrong conclusion. Similarly, on your examination, you might find something that doesn't necessarily specifically tie you to one thing. And then based on what you have, you say, I think this is what the patient has. And if you don't then have the second part, which is the diagnostics, then you're sometimes, not to say often you could, as a clinician, you can do it without that, but there's a chance that you could be wrong. And that's what we call a misdiagnosis. And if you're often working in the dark, sometimes you just get used to doing it and you start relying on just the things you hear or you see, and that might make you make the wrong decision. In 75%, I'm just throwing numbers out there, in a certain number of people, that might not matter because the treatment may be fairly similar, but in a proportion of people, making that wrong diagnosis might mean getting the wrong medication. And either you don't get better or the medication might actually be the wrong thing for your problem, which might actually make you worse. So there are consequences to misdiagnosis, and often you can avoid it if you had adequate diagnostics to go along with the clinical thing that you're doing. So the consequences of misdiagnosis can vary. They can vary from being something very minute and vary to being something grave, the gravest of which everybody thinks about is death. If you miss a particular diagnosis, and we've all seen this happen at some point, you miss something very serious because you didn't have the diagnostics or the clinical acumen, and then the person then, whenever it's found, it's too late or it's never found, and the person ends up dying, because the ultimate end of an illness, if not treated properly, often may result in death. So that's the worst it could be. On the other end of it, it could be something very small, like, okay, I give you the wrong medicine, you feel you have nausea or you're vomiting or something like that, or you continue to be in pain for some time until we find the right diagnosis. So it's a whole spectrum. It goes from very minute to very grave, but even the small ones can be avoided, and we should try and avoid as many as possible. So what we want to provide for Gambia is, as I said, giving that environment so that if you walk into JAMA as a hospital, that you're not going to feel that because you're in Gambia, you are getting somewhat substandard care. That the instruments that you see being used, you know that you would get elsewhere. The level of the doctor that care from the doctors and the nurses is also at a level that you'd expect elsewhere. And that was the reason also why we went into partnership with AQA, because we looked around and we thought, yes, we could possibly look at getting our own lab and trying to manage it. But we all know where we send our lab tests to, and the reason we send it there is the confidence in this lab, AQA, because of the fact that they are dedicated to excellence. And our tagline is healing with care and excellence. And they just tie in together. The values that we have are very similar to what the values of AQA is, making sure that Gambians get best care, get a varied the types of care, and also making sure that we're committed to making sure the care is excellent. Another thing we actually didn't touch on about misdiagnosis is the fact that not just not having the test, but sometimes not being able to rely on the result. And that's one thing that we don't have with AQA. Wherever we've been in the past, whenever you had a test that just didn't feel right, we would say run it again at AQA because we would trust that result. And it's that quality of care that's also very important, not just the amount of different tests you can do. It's making sure you have that eye for quality and that dedication to producing quality.
Now I've learned a lot, just like you, about the importance of a medical diagnostics lab within the healthcare system. It has made me also have a lot of questions about AQA, this company that doctors are referring to that has actually been able to build an entire ecosystem of quality diagnostic services to hospitals, clinics, and their own hospital in the country. So in the next part of this episode, we're going to meet with the founders of AQA and get to know the story behind this organization. Many people think that it's just a small lab located somewhere there in Kanifing, but in reality, this small lab hides a lot of big things. Let's go find out.